Hello students, welcome back to Easy Nurse, where nursing education made easy. So mainly in this live session we are going to take regarding the community health nursing, and especially in this session we are going to discuss regarding unit 4 and unit 5. So let's start about the today's session. First is the health education. So what do you mean by the health education? So in the hospital settings, when the healthcare workers, they are giving some instruction as well as the informations to keep the healthy of the human diet as well as the persons. So that time it's called as a health education, means healthy informations when we are going to provide to the patients for keeping them healthy as well as maintain the balanced diet, proper sleeping pattern. So that is called health education, which will be helpful for preventions of the many diseases. So let's see the definitions. Health education is nothing but it's a process of the providing information as well as a resource to individuals and then communities for helping them improve their health by promoting the healthy behaviors, preventing the diseases and making the informed decision. Means based decision they have to make for prevent the disease, how they can able to manage the disease, how they can able to prevent the disease. So that kind of the decision they have to take. So if they don't have the proper knowledge, whether they can able to take the decisions, no, right? So that's why as a healthcare workers, it's our duty to provide the informations. So it involves the teaching about the various health topics such as nutrition, hygiene, disease prevention, lifestyle choices for enhancing the overall health and then quality of life. So what are the aims of the health education? First is promotions of the healthy living. Next one is the prevention of the diseases. Next is the early diagnosis and then treatment. So such as example, the patient is having a prone for the cancer. Okay, so if we are going to diagnose this cancer in early stage, so the cancer it should be treatable for that person, and the person can able to lead the healthy lifestyle. So that's why early diagnosis and treatment is very much important factor, especially such kind of the communicable as well as the non-communicable diseases. Next one is enhancing the quality of the life, then encouraging the self-care. Next is reducing the health inequalities. Next is creating the awareness about the health services. And next one is improving the environmental health. And last one is empowering the communities and then supporting the national health goals. Okay, so now come to the concept of the health education. So there are so many concepts are there. First is the holistic approach. So based on the holistic approach, health education is nothing but it is considered as a physical, mental, emotional and then social well-being rather than just the absence of the disease. So when the person is completely fit and fine from the physical status, mental status as well as the emotional and then spiritual as well as the social factor, so that time we can consider the person as a healthy. Next is promotion of the positive healthy behavior. So we have to encourage the individuals from the hospital as well as the community settings for adopting the behaviors which should be enhancing the health and then prevention of the diseases. As example, the lifestyle changes. Next one is the healthy diet, regular exercise, proper sleeping pattern, everything. Next one is target the audience specificity. So what is this? Mainly health education which must be tailored for the different groups, and this health education it should be based on the age, literacy, cultural beliefs and then socio-economic status. Okay, so now come to the next use of the effective communication. So when as a healthcare workers we are going to provide the information to the community people, so obviously we have to address the language is very general language, okay, which should be easily understandable. If you are giving the lecture through the English, so it should be very general English, and then the pronunciation as well as everything should be like a very lightweight. So what will happen, the other persons means the community people, they can able to understand easily what you actually want to express. Okay, next one is the lifelong learning process. So health education is an ongoing process which might be continued throughout the life, and it's going to adapting a new challenges as well as the discoveries. Now come to the multidisciplinary approach. So into this we have to incorporate the knowledge from the medical science, behavioral science, sociology and then communication for enhancing the effectiveness. Now come to the scope of health education. First is healthy policy and then advocacy. Next one is the health education in the mass media, means through the social media we have to deliver the concept, or we have to deliver the information among the community people. Next is individual health education. So when we are going for the family visit as well as the hospitals bed to bed, so we have to give the individually patients as a health educations. Okay, next one is the family health educations. Next one is the school health education, mainly for the teenage group of people, for them other health education, as well as for the children's also there are separate health education. Next one is the community health education, then occupational health education. So based on your occupation, what you have to fulfill it or what you have to manage along with this professional. So along with that professional, what should be the trigger factor for your health which might be affecting your healthy behavior as well as the healthy status, that also you have to know, and based on that you have to manage it, and how you have to manage that is also you have to take the guide from the healthcare workers. Next one is the preventive health educations and then rehabilitation education. Now come to the national plan for the health education. So mainly there is the national plan of health education. It's a very strategic framework which guides the health education initiatives at the national level. So see the components. First is the goals and objectives. Okay, so under this improve the health literacy and then awareness. Next one is the promote the preventive health measures, encourage the healthy lifestyle as well as the behavior for the community people, support the disease control treatment as well as the management of the healthy programs. Now come to the target audience. So into this target audience, obviously first come to the general public. So all age group of the people in one community settings. Next is the high risk group of people. As example, pregnant mother, then elderly people as well as the people with any kind of the chronic diseases. As example like diabetes mellitus or the cancer or tuberculosis, anything. Okay. Next come to the healthcare professionals and then school children as well as the other persons. So now come to the healthy topics covers. What topics we have to cover in the health education. First is the communicable disease. So into this communicable disease, mainly we have to focus for the HIV and then AIDS. How it's going to spread? What is the main symptoms for the HIV and AIDS? What is the main causative factor for the HIV and AIDS? How they can able to prevent? Okay, so everything. As well as the tuberculosis, same. Mainly for the tuberculosis, we have to take a focus on the treatment. Okay, like first line drug, second line drug, everything we have to disclose to the patient. So what will happen? They can able to understand, and based on that they will continue their treatment. Next is the malaria. Okay. Now come to the non-communicable disease. As example, diabetes, hypertension, cancer, etc. So next is the maternal and child health. So during the conception as well as after conceiving of the pregnancy, during delivery as well as the after delivery, means post-delivery period, every time the mother is in the danger positions, anytime anything might be happen for the pregnant woman. Okay, so that's why maternal health is one of the most important topic. For that we have to give the proper education, especially regarding the diet, especially regarding the immunization, means tetanus toxoid 1 and 2, as well as the like iron and folic acid supplementation. Why they need to give why they need to take the iron and folic acid? Mainly they have the misconception like the iron they are taking means folic acid is no needed, but no, folic acid also you have to take, because folic acid is help to prevent any kind of the neurological disorder for your fetus. So that also we have to, this kind of information also we have to disclose to the community people. Okay, next come to the nutritional as well as the anemia prevention, then environmental as well as the occupational health, mental health awareness, how they have to keep their mental health healthy. So these topics, tricks and tactics, everything we have to say. Now come to the implementation strategies. So under this mass media campaign, so under this mass media campaign like the TV, radio, social media, newspaper, poster, pamphlet, leaflet, everything we can do it. Next come to the school health education. So into this we have to mainly integrating the health topics into the curriculum. Now come to the community based program. So mainly we have to focus on the awareness camps as well as the healthy talks. Now come to the workplace health promotion. So mainly we have to focus the employees wellness structure, employees wellness program, whether any kind of system work or any kind of the like excessive physical stress, whether it will be affecting their health or not. So these kind of the awareness as well as assessment we have to do it. Now come to the training of the health workers. as examples capacity building for the health educators. Now come to the government involvement and then policies. So under this Ministry of the Health coordination, collaboration with any kind of the non-governmental organization or NGO as well as the private sector for taking the fund and for improving the healthy quality of the care providing. Now come to the policy support for health promotion and then disease prevention. So now come to the communication techniques. So communication is nothing but it's a process of the information, ideas, thoughts or the feelings between individual and groups throughout the verbal way, non-verbal way, written way as well as the visual manners. So what are the components? First is the sender, means we is sending this message. Then message means the information. Next one is the medium, through how it's going to pass, either through the social media, either through any kind of the orally as well as a face-to-face conversation, anything. And next one is the receiver, who is going to receive that particular information, means as example the patient. Okay, so after that feedback, so from the patient we have to take the feedback whether that information is going to be effective for them or not. Okay. Now come to the techniques of the communication. First is the verbal communication, like face-to-face communication, lectures or the presentation, then group discussions. Now next come to the counseling. Okay, so through the counseling also, like one person they are sharing to their feelings, thoughts, everything to the counselor. Now come to the non-verbal communication. So in the non-verbal communication, like body language, eye language, visual aids, sign language, everything. Now come to the written communication. So it is pamphlets or leaflets. Next is the posters as well as the banners, then health magazine as well as the articles. Now come to the audio visual communication, means audio is also there, visual is also there. So what is this? Radio, television. Next one is the videos as well as the documentaries, social media and then digital campaigns. Now come to the interpersonal communication. So into this peer education, then community meetings. Next one is the home visit. Now come to the mass communication. So it is this public announcement. Next one is the newspaper and then newsletter. Then billboards as well as the headings. So now come to the methods of the health education. So individual method, like personal counseling, means personally, individually we have to do the health education. Home visit, when we are going for the home visit, so one by one home we have to do it the health education for every group of the people. Next is the patient education, bed to bed we have to do it. Now come to the mass education method. So into this campaign is there, health exhibition is there, street plays as well as the folk media. Group method, under this lectures, group discussion, demonstration, workshop or the seminar. Now come to the media of the health education. So first is the traditional media. So into this folk song or drama, then puppetry, etc. Then print media, into this posters or the charts, then pamphlets and then brochures, the newspaper as well as the magazine, and then electronic media like radio and television, documentaries and films. And last is the digital media. So under the social media platform, mobile apps or SMS service and webinars or the e-learning. Okay, so now come the role of nurse in the health education. So first is the educator and then counselor. So in the health education, while we are going to provide the health education, the nurse's main and first role is the educator and counselor. So we have to disclose the topics as well as we have to counsel the persons and we have to listen the other person's thoughts and then their ideas about that particular topic. Now come to the promotion of the preventive health. Next one is a facilitator of the group health education. Next one is the advocate for the public health policy, use of the communication and the media, trainer and mentor of the health workers, means all other health workers should be there. So nurses have to play the main key role for as a trainer and mentor for the other health workers. Then emotional and then psychological support. So now come to the role of the community health nurse. What is the general role? Okay, first is the health promotion and then education for the community people, and health promotion by providing the proper healthy behavior, lifestyle as well as other informations to prevention of the disease as well as providing the proper education. Next is the disease prevention and control for each and every level like primary, secondary as well as the tertiary level. Next is the maternal and then child health service. They have to focus on the high risk pregnancy cases, antenatal cases as well as the internatal and postnatal cases, as well as after delivery also they have to take care for the mother as well as the children, and regular assessment should be there. Next is the primary healthcare services, then family planning as well as the reproductive health. What is the family planning, why it's needed, what are the methods of the family planning, which couple can go for the family planning, everything we have to explain to the patients, and we have to make sure the patients to do the family planning minimum after minimum of the 2 kids. Okay, now come to the environmental health and then sanitations, community based rehabilitation program, home based care as well as the palliative services, surveillance and reporting. Next one is the disaster preparedness and response. Now come to the national health program. So due to the prevention of communicable as well as the non-communicable disease, from the government of India, they are like launching so many programs in our India for awareness of the increase the awareness among the community people, okay, about the particular diseases. So that is the national health programs. So mainly it is designed to address the various public health issues as well as improve their overall health status of the population, and these programs are also implemented by the Ministry of Health and Family Welfare. Okay, so first is National Health Mission or NHM. So what is includes National Rural Health Mission, NRHM, focused on the rural healthcare, means rural area, and as well as National Urban Health Mission, they mainly focus on the urban area as well as the population. Now come to the reproductive, maternal, newborn, child health as well as the adolescent health, that is RMCH plus A. So main objective is nothing but improving the maternal as well as the childhood through the self motherhood as well as the like newborn care and the adolescent health services. Next is the National AIDS Control Program, NACP. So under this main objective, prevention and control of the spread of HIV or the AIDS by promotion of the awareness and providing the proper information how they can able to prevent, and implemented by the National AIDS Control Organization. Okay, so now come to the National Tuberculosis Elimination Program, NTEP, which was main objective is eliminated the tuberculosis by the year of 2025. Now come to the National Vector Disease Control Program, NVDCP. So main objective is nothing but control the disease like malaria, dengue, chikungunya, filariasis as well as the Japanese encephalitis. So nothing but they mainly focus to control as well as prevention of the disease which is mainly causing by the flies. Okay. Now come to the National Program for the Prevention and Control of the Cancer, Diabetes, Cardiovascular Disease as well as the stroke. So NPCD-CDS. Okay. So what is the main objective? Early detection and management of the non-communicable diseases. So main key components are nothing but screening the camps as well as the lifestyle modification awareness. Now come to the National Program for Control of the Blindness as well as the visual impairment. So main objective is nothing but reducing the preventable blindness through the free cataract surgery and eye care services. Next is National Mental Health Program, NMHP. So main objective is nothing but providing the accessible and then affordable mental health services. So what is the Initiative District Mental Health Program, DMHP, as well as the Suicide Prevention Helplines. Now come to the National Program for Prevention and Control of the Deafness. So into this objective is nothing but early detection and interventions for the hearing disabilities. Next come to the National Program for the Healthcare of the Elderly, NPHCE. So main objective is nothing but provide the healthcare services to the elderly populations. Okay. Now come to the Mother and then Children Health Program. So for that, like MCH programs, so in India they are mainly focusing on the improving the health as well as the well-being of the mothers, newborn child and then children. So these programs is going to implement under the National Health Mission for reducing the maternal and infant mortality, morbidity rate as well as ensure the safe pregnancy and then delivery for the mother, either normal cases as well as complicated cases. Okay, so first is reproductive, maternal, newborn, child health, adolescent health, which is RMCH plus A program. So main objective, as I said, like a continue of the care of the women and children from pregnancy till the adolescent. So what is the main key components? First is reproductive health like family planning, contraception, fertilization, infertility service, etc. Now come to the maternal health. So into this mainly antenatal care, skilled delivery practices as well as the postnatal care. Newborn health under this neonatal intensive care, breastfeeding, promotion, etc. Now come to the child health. So into this immunization, nutritional support, early childhood care, etc. And in adolescent health, very much important, that is menstrual hygiene, then anemia control and sex health education. Okay. Now come to the Janani Suraksha Yojana. So under this, it's mainly focusing on the reducing maternal and the neonatal mortality by promotions of the institutional deliveries. Okay. So what is the key features? Like cash incentives for the pregnant women who deliver in the government hospitals. Next, special benefits for the women who are below the poverty line, BPL family, and scheduled caste or the tribes. And accredited social health services or the ASHAs, they help mobilize the pregnant women from the helpful deliveries. Now come to the Janani Shishu Suraksha Karyakaram. So JSSK. Okay, so main objectives ensure the free and cashless maternity services for the pregnant woman and the sick newborn. Now come to the key benefits. So what is this? Free normal and then cesarean delivery in the government hospitals, free medicine diagnostic test as well as the blood transfusions for the pregnant mother, and free transport like home to hospital, hospital to hospital as well as hospital to home. Okay. Now come to the Pradhan Mantri Matru Vandana Yojana. So PMMVY. So main objective is nothing but providing the financial support for the pregnant as well as the lactating woman for the first live birth. So what is the key benefit? Up to rupees 5,000 incentive they are going to provide in 3 installments for the nutrition and their health needs, as well as additional benefits under the Janani Suraksha Yojana for institutional delivery. Now come to the Poshan Vision. So National Nutrition Mission. So main objective is nothing but reducing the malnutrition among the children as well as pregnant and lactating women. So what is the key features? Promotions of the breastfeeding and complementary feeding, growth monitoring for the children, community based management for the severe acute malnutrition. Next is the missions Indradhanush. So under this, what is the main objectives? Achieve the full immunization coverage for the children and pregnant women. So key vaccination is nothing but like BCG, hepatitis B, polio, DPT, measles, rotavirus as well as the pneumococcal vaccine, etc. and special focus on the high risk cases. So now come to the Surakshit Mantriva ASEAN ACUMA Yojana. So what is the main objectives? Provide the assured, dignified and then respectful maternity care services. So what is the key features? Free antenatal and postnatal checkups, free institutional delivery and then newborn care, zero tolerance for the denial of the maternal health services. Now come to the weekly iron and folic acid supplementation WIFS program. So what is the main objectives? Prevention and control of the anemia among the adolescent girls and pregnant women. Key features is nothing but weekly iron and folic acid supplementation, deworming tablets for improving the iron absorption. Now come to the Rashtriya Balshastya Karyakaram RBSK. Main objectives is early detection and management of the disease whichever present in the children. And what is the key features? Screening of the children for 4D. What is the 4D? Defection of the at birth, disease, deficiencies and development delays. So free treatment and referral service for the identified conditions. Okay. Now come to the most important topic, that is school health service. So school health service is nothing but it's mainly for improving the overall health as well as the well-being of the school going children through the preventive, promotive as well as the curative healthcare intervention. So mainly this service they are going to part of the National Health Initiative as well as they are mainly focusing on the early disease detection, nutrition, hygiene as well as the mental well-being. Okay. So what is the objectives of the school health service? First is early detection and prevention of the diseases like anemia, malnutrition, vision as well as the hearing problems. Next come to the health education based on hygiene, nutrition, reproductive health and substance abuse. Then immunization or the deworming for protections of the children from infectious diseases, maternal health support for the stress, anxiety and behavioral issues. Then promotions of the healthy lifestyle for prevention of the non-communicable diseases. Okay, now come to the components. First is Rashtriya Balshastya Karyakaram. So objectives early identification and management of the diseases in children. So service provided in the 4 Ds like defects at birth, deficiencies, childhood disease as example tuberculosis, skin infection and developmental delays like speech as well as the motor skill issues. Now come to the school health programs HHP under the Ayushman Bharat. So mainly the objectives is nothing but provide the age appropriate health education and their services in the schools. So what are the key features? First is health and wellness ambassadors. So these 2 teachers in the each school trained to promote the health awareness. Next is the health and wellness sessions. So cover the nutrition, physical exercise, substance abuse, abuse prevention and then mental health. Now come to the regular screening and checkup. So mainly for for the vision, hearing, dental and general health assessment. Now come to the national immunization program. So it's mainly ensure the vaccination of the school age children against diseases like tetanus, diphtheria, measles and rubella. So includes the special drives like Mission Indradhanush for the missed vaccination. Now come to the midday meal schemes or the MDMS. They are providing the nutritious meals for the school children for improving the nutritional status, as well as they are going to reduce the malnutrition and anemia among the students and promotes the better attendance and then learning outcomes. Okay. Now come to the weekly and iron folic acid supplementation program. They are mainly prevention as well as control the iron deficiency anemia for the school children, especially up to 6 to 19 years of the age group. Weekly iron and folic acid tablets they are going to provide in the school, and deworming tablets also given in twice a year. National Deworming Day, February and August. Now come to the adolescent reproductive as well as the sexual health ARSH program. So mainly they are providing the awareness on the puberty, menstruation, hygiene and then reproductive health. They are addressing issues like teenage pregnancy, substance abuse and sexually transmitted infection, and it's also going to include the adolescent friendly health clinics AFHCS for the counseling as well as the support for the children. Now come to the training of the healthcare workers. So this training is going to equip with the healthcare with the knowledge, skills as well as attitude which needed for the efficient healthcare delivery. So what are the types of training? First is pre-service, in-service and on the job. Okay. So pre-service is nothing but formal education before joining the health services, as example medical or nursing college or school. Now come to the in-service training. So into this continuous education for currently employed staff to update their knowledge, and on the job means practical training provided in the workplace while they are going to performing the task. Now come to the objectives. So what are the objectives? First is improve the technical skills like maternal and child health as well as the immunization. Now enhance the communication and then counseling skills, promotions of the understanding of the public health programs like tuberculosis, HIV or the AIDS, STD control, etc. Strengthen the leadership and management abilities. Now come to the methods of the training. So into this lecture and classroom teaching, workshop, seminar, webinar, hands-on demonstration, role play as well as simulation exercise and e-learning modules. Now come to the supervisions of the healthcare workers. So supervision is ensure the healthcare workers are performing the effectively, following protocols and providing the quality of the care. So what are the types? First is supportive, next is administrative and second one is the clinical. Supportive means they are mainly focused on the mentorship, problem solving and capacity building. And administrative supervision is mainly focused on the policy complaints, attendance and then resource management. And next is the clinical supervision which ensure the clinical guidelines which should be followed for the patient care. Now come to the objectives. So objectives is nothing but they are improving the performance and accountability, then providing the ongoing feedback and then support from the patient as well as from the in-charge, then identify the gaps in the skills and knowledge and ensure the adherence for standards and then protocols. Now come to the process of the supervision. So what are the process? First is the planning. So when as a nursing in-charge, when they are going to planning for giving the proper training to the any kind of nurses, so what they have to do? First they have to assess how much they knows about that particular task, okay, and how they have to improve it and what and which place they have to improve, right? So based on that they have to do the proper assessment, and based on that they have to do the planning. So after that they have to say means they have to implement their plan on that particular nursing stuff. So after that they have to do the observations whether it's going to be effective for them or not. So after observing again they have to go for the assessment like previous knowledge as well as now how much they are improving. So based on that they have to do the assessment, and after that we have to give the proper feedback as well as the guidance to that particular nurses. So what will happen? They will get the proper motivation for improving themselves more and more, okay, and based on that we have to do the follow-up for every nursing staff. So these all are the process of the supervision, okay. Now come to the tools used. So what are the tools you can use for the supervision? First is the checklist you can use, sometimes performance appraisal, some points also you can give to the particular nurses. So what will happen? That point they can convert into the monies, okay. So these kind of points if you are giving this, what will happen? Everyone will know this nursing staff is trying trying to do their best. Okay, so this kind of performance appraisal from the organization, if they are giving means, the person will be motivated to do their best. And next is the monitoring and then evaluation system. So these all are the tools we can use. Okay, so thank you. I hope you all understood my session. Again we will meet in next session. Till that, keep learning and stay tuned with the easiness. Thank you.